My name is Richard Hamilton, and I'm a plastic surgeon based in Adelaide, and I've always lived and practiced in Adelaide apart from my overseas training in New Zealand and in Sweden. Most of my work is skin and skin cancer related, but I also do benign skin lesions such as moles in cosmetically sensitive areas. That's really important. I do a lot of aesthetic breast surgery, so breast augmentations, breast lifts and breast reductions, and also in the cosmetic field I do facial rejuvenation. I do correction of prominent ears. I love doing upper eyelids. I do lip lifts and a number of other things. Well, the Australian Society of Plastic Surgeons is the premium body representing plastic surgeons, and if you're a member of ASPS, it's really an endorsement of your background, your training, and the fact that you've achieved a fellowship of the Royal Australasian College of Surgeons in plastic surgery, and that's the gold standard for plastic surgery training. So look, it's really important to be a member of that group, and there are lots of other advantages in terms of collegiality. You know, we've got to talk to our friends and colleagues in different parts of the country, and we learn a lot from them. And of course, the overall educational program, which is second to none. Well, look, I think that plastic surgery, like all branches of medicine, it's really important for we to regard this as being lifelong learning. You have to learn throughout your whole career. And I can say that the way in which I conduct my practice is very different from what it was 20 or so years ago when I entered practice. Now, if I didn't come to meetings like the PSC or the ASPS meetings and college meetings, I would be stuck in a time warp 20 years ago. So things change, we have to move forward because things are always improving. Our techniques and our implant devices are much better than they were 20 years ago. Well, I was working in New Zealand at the time and in general surgery, and I had a rotation at Burwood Hospital in Christchurch to work for 6 months in the plastic surgery unit. And I was just so overwhelmed by the beauty of the specialty and how much we could help patients, be they burns patients or patients with hand injuries. And that's also another thing that I do. I do quite a lot of hand surgery and also on congenital anomalies. And I mentioned children with prominent ears. To correct those makes an enormous difference to a child's life. And then when I was in Christchurch, I read about this new field called microsurgery, where tissue could be transplanted from one part of the body to another part, and that was the thing that clinched it for me. And so I was very lucky to get a job at St Vincent's in Melbourne, which was the leading unit in the world in microsurgery. And subsequent to that, I was asked to go to Sweden and help them set up microsurgery. So that's how it all happened before I went back to Adelaide to practice.